I am honored to introduce Brian Jamal Dixon.
Alrighty, y'all, so I'm going to talk really loudly. We're going to go very quickly. So just a little bit about my background. So I finished a triple board residency, so pediatrics, psychiatry, and adult and child psychiatry at the University of Kentucky. So after I did that, I moved back to Texas because I love Texas. I'm from Texas. I worked at a children's hospital, and I was doing the grind, taking care of my babies, and I got burned out, and I decided to quit. And I took 2 months off, and I said, if this doesn't change, then either I'm going to die from stress, or it's just not going to work. And so did a lot of soul searching, decided, you know what, I really like seeing patients. I love seeing patients. That's my calling. But we need to do it in a system. We need to have a better system in which to do our healthcare. And so when I initially put this whole thing together, it's more of a comprehensive plan. I'm going to walk you through how the mental health fits into it. But a couple of different things before we get started. This is an idea. It's a paradigm shifting idea. There's nothing to buy. What I need y'all to do is to believe that there's a different way, and that way will actually help us all create universal access to healthcare. I think that one of the reasons why no plan will work right now is because they all contain a fatal flaw, which I'll talk about in just a second. One of my favorite movies of all time is Pollyanna, and I don't know if y'all have ever seen that movie, but I honestly believe that in the goodness of people, I think especially for Americans, I think that if we as Americans are giving reasonable choices, we make reasonable decisions, and we come out on the other side as better people. I said in 9 easy slides because I don't like to belabor the point, and I like to talk a lot more than I want y'all to read. So one of the main issues right now is that our current premise is we want to find the best way to pay for health insurance to pay for health care, which doesn't make any sense to me. That's one too many steps. And so what I propose is we get rid of the insurance model or the need for insurance. And so this is a fundamental issue, and I want y'all to take this away from this meeting. And when I gave this presentation to a room of psychiatrists, 4 of them came up to me and they said, "Do you have protection?" And I said, "What do you mean?" And they said, when you go out and you spread this idea, you're going to be costing people hundreds of millions of dollars, if not hundreds of billions of dollars. You really need to start packing heat. Now in Texas, we have open carry and it's a whole hot mess, but that's besides the point. But the idea is there's going to be lots of people who are going to lose money, but that won't be us. It won't be us as patients. It won't be us as physicians. It will be people who don't need to be in the middle anyway. So I'm going to walk you through this process. So what is psych? I nicknamed it psych because I thought it would be really, really cute. It stands for Practical Solutions Yielding Comprehensive Healthcare. Again, it's just, I believe that we can build a better system. It's a bipartisan approach or a transpartisan or a nonpartisan approach to creating universal access to quality, affordable healthcare. Again, not quality, affordable insurance. That is the rate limiting step. That is the fatal flaw of the plan by Collins and Cassidy, by the Sessions and I can't remember who the other person is, plan. Again, I supported Barack Obama during his presidency when he did the Affordable Care Act. I said that's a really terrible idea because, again, it includes health insurance as a fundamental principle. And the problem with health insurance is we can't control the cost because it's a private product. Some company sits down, they have their actuaries, they go through and they decide, hey, we're just going to make up this price and people are going to pay it. And there's no transparency. So what I'm going to present to you really quickly is essentially we are going to change the way that the funding structure works so that then people will have the money in their pockets to buy the health care that they need. So step 1, what we have to do is we have to create 50 nonprofit, state-based, statewide, state health companies. So essentially, every person in that state, 18 and older, will be a citizen shareholder. Now, this is absolutely key because this is how we get rid of the perverse incentive. Right now, the board of Aetna answers to their shareholders, right? So they're going to keep driving up the price because the shareholders are getting their dividends. Some of us actually may be shareholders in this room if you have a 401k or some other type of stock market, or if you own stocks in the company. So how do we eliminate the perverse incentive? Well, we create a state-based company. So I'm from Texas. We have 27 million people in Texas. All 27 million people are now part of that company. That all of those 27 million people, we elect a board of directors, 60% of which needs to be healthcare related. So nurses, doctors, optometrists, psychologists, psychiatrists, dentists, acupuncturists, as long as they have a medical licensure of that's recognized in that state. And I say 60% because they're going to be working in the best interest of the patients. They, as a board of directors. The board of directors then sets the charge master. So charge masters already exist. Medicare has one, Medicaid has one, Aetna has one, Cigna has one. What we do is that the state board of directors creates their version of the charge master, which we can all see. So, and there's two charge masters. One charge master is for the sick visits, another for preventative visits. So now we all have a general idea of what things cost. Now, as a private provider, either as a physician, nurse, if you want to start a home health company, whatever you want to do, you can still charge whatever you want to charge. But when you submit your bill or your claim to the health fund for the state, you'll know how much you are likely to get back, depending on how you set up the general health fund. The way that I like, it's my firm belief that when people invest in themselves, that you get better outcomes. And so that's why we have to have a general health fee that every person pays. So the board of directors establishes whatever that fee is, $1,000 a year, $500 a year. There's a friend of mine, she's from Jasper, Texas, which is in the middle of nowhere. And she would always joke, if it's free, give me three. And she said that because, again, that which you don't pay for, you want more of, right? So we all, and this is just more of like a human condition, we all tend to do this. So what I've noticed in my private practice is that when people pay the money to see me, they keep their appointments, they actually actively work to feel better, okay? So we have to have a general health fee. During the panel discussion, we can talk about some of the nuances and details. And I also want y'all to keep in mind, this is truly a chassis. So I work 60 hours a week in my private practice and I'm doing other stuff. I am not so full of hubris to think that every detail I've hammered out. This is more of a chassis so that then I can invite y'all and we can all have a national conversation about all the accoutrement to add to the chassis to make this work. But anyway, so we have the state health company. We have the board of directors. They have established the charge masters. When it comes to the sick visit charge master, it will reimburse any charge that's unrelated to lifestyle choice. So this is how we incentivize people to take care of themselves, okay? So for those times, for those diagnoses that are unrelated to lifestyle choice, so ovarian cancer, you didn't do anything to cause yourself to have ovarian cancer. If you'll establish a charge master of how much that treatment course costs, including the chemo and the whole 9 yards, and that'll just be a set reimbursement fee, and then that person can then take that amount of money or knowledge of that money and shop around wherever you want your care. If Cancer Centers of America, MD Anderson, you can do whatever you want to do, and then you'll be reimbursed a certain amount. And again, I'll talk about some of those details a little bit later. The piece de resistance that I just love the most. So now we can also establish an annual well person exam. So when you pay your fee, and everybody needs to pay the fee, once you pay your fee, you are entitled to a well person visit. That includes medical, mental health, dental, vision, lab work, and then a certain amount of medications depending on however your state decides to set it up. Now we have longitudinal data, finally, so that then we can actually prevent a lot of things. Including any of your screenings, we can catch diabetes a lot earlier when we do your fasting blood sugar. Each year we can trend these things. And so that's how we establish a new paradigm with preventative health care. And this is a good compromise makes everybody mad, right? So I'm gonna piss a whole bunch of people off, doctors included, with this one, but I firmly believe we need this. So the board of directors from all the states, we get them all together, we lock them in a gym, we give them some wood, and we say, like papal conclave style, you can't leave this gym until y'all figure out one medical record, one commercially available medical record. I love the government. The government is great. They are terrible with all things technological. So they should not be in charge of making a electronic health record. Instead, they should provide the safety and cyber protection. But we decide. So if it's Epic, it's Epic. If it's Allscripts, it's Allscripts. Whoever we go with, we decide to go with. So that now we have a true universal medical record. No matter where you go, if you're on vacation, if you go to New York, if you go to a different place, your medical record follows you. There's no reason why we don't do this. It decreases duplication of care. We get rid of this whole defensive medicine issue as well, because again, we can trend it from beginning to end, from birth to death. And then lastly, I've become something of a capitalist, apparently, in running my own private practice. We don't tell businesses what to charge things. I don't go to Starbucks and say, hey, your macchiato really needs to be $1, right? We, as much as I hate what Merck did when they increased the price of the EpiPen to $600 or whatever ridiculous amount it was, I don't have the right to tell them what to charge. So instead, let's change the market dynamic. So now that we have 50 states, we have 50 private companies of which the citizens own, each state, just like Costco, that company will then go buy drugs wherever they want to buy drugs, buy them in bulk so that you can offer them to your people at a discount, whatever that discount is. So now we don't have to regulate Merck, because when we go to Merck Canada or we go to Merck Ireland and we say, hey, well, can we buy your EpiPen instead? And they go, sure, then that's going to cause Merck America to get their act together. Yes, there are some acts of Congressy things that have to happen as part of this, this particular presentation, but that's how we're going to get the cost of drugs down. Now, how do we implement this? And this is where I give it all to Marion. She's a phenomenal leader and speaker. So when I thought up this plan, I said we need to start with kids first. We build a whole entire system. We get the board of directors. We get the general health fee. We establish the charge masters. We do all of that work, and then we implement it with kids first, because kids should always have access to health care. It doesn't make any sense not to, right? Then we add the chronically medically ill, so those are your cystic fibrosis patients, your sickle cell anemias, again, all of those chronic medical illnesses that we don't have any control over, and then the IDD population. So as a psychiatrist, I work with autistic kids and I work with kids with intellectual disabilities all the time. Again, there's no reason why we shouldn't cover them. So we add them into the mix and we churn the system. We see how it works. Then we add in the military. And we churn the system, see how it works. We add geriatrics and the able-bodied, able-minded. If we want to take a different approach, we can do it on specialty. So we can start with mental health. So we build an entire system, and we only have psychiatrists and therapists, and we do the system that way. Then we add in medical and medical subspecialties, and surgical subspecialties. So what are the results? So number one, we remove perverse incentives. So no longer do we have to worry about who's winning, because we all win. We're all part of our own state system. If for some reason you overshot, so you charge everybody $2,000 a person and you have money left over in the pot where you're a nonprofit company, you can either just pay it back to the people who put it in, or you can use it for other things, research, innovation, whatever y'all decide in your state bylaws. This improves civic and personal responsibility. So civic responsibility, it's abhorrent that I think it was maybe 40 to 50% people voted in this latest election when everybody's mad about healthcare. 100% of Americans are mad about healthcare. So how can we actually improve civic responsibility? You make it state-based. So if you don't like what is going on in your health company, you recall your board of directors. That's what every company does currently anyway. If you don't like either, you don't like anything about them. And then personal responsibility. So now we finally have a means to incentivize people to take care of yourself. Because of the way that the plan is set up, you actually keep a lot of money in your pocket. We would eliminate Medicare because it'd be pointless to have a whole separate system. So you keep your Medicare contributions in your pocket. We eliminate employer-based health insurance. So you no longer, as an employee, you don't have to pay premiums. You keep the premiums in your pocket. For the employer-based, so when companies no longer have to provide health care for you because it's incredibly expensive, then they're going to be incentivized to pay you more to keep you at that job. So now you have 3 different ways of getting money in your pocket, $2,000 to $5,000 a year, that you can then use to go and buy your health care. You pay your $500 into the general fee, and then now that you have money in your pocket, studies show that, studies show that you're going to be more likely to hang on to your dollars. You're going to be incentivized to take care of yourself. We eliminate mental health stigma because, again, everybody sees a mental health professional from birth to death. We get a local access to veterans because, again, it doesn't make sense to have a duplicate system for our veterans. It's citizenship neutral and women's health inclusive. So we don't have to argue about who's paying for contraception because you get to pay for your own contraception just like I get to pay for all of the stuff that I feel that I need. And one thing that's near and dear to my heart, it revolutionizes the foster care system. So foster care is broken because we don't talk to each other. We create a system where all of us get to talk, and all of that is much better. So that's the website. There's a whole video. It's a 3-minute video that I paid a whole bunch of money for. Share that site. Go out. Again, this is a work in progress. So the whole goal is for you to talk. We need to talk. We need to heal as a country. And if we're going to heal, we have to recognize that health insurance is not going to save us in the long run. So reach across the aisle. Let's talk about how to change healthcare. Thanks so much.